Aloha, welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Senator, ER doc on the Big Island, and really just a proud participant in a show that brings great guests here to talk about healthcare in our state. Today I have an extreme pleasure of interviewing, kind of hot off the press, our new Director of Health, Dr. Ginny Pressler. Ginny's been with us before in the program. She's held programs, she's led task forces, she's led departments. She had her education in medicine. She's a surgeon, spent time at Harvard, was in the Department of Health before as a leader, and then went on to great things in the private sector. Most recently, Ginny was Executive Vice President?
Executive Vice President and Chief Strategic Officer at Hawaii Pacific Health.
The big kahuna over at Hawaii Pacific Health with Ray Vera, who's also a good friend, and has participated in the constant and ever more complex dialogue about healthcare. So to have Ginny here today is a great honor, but this comes just a week after she was confirmed as our Director of Health. So congratulations.
Right. Thank you, Josh. Appreciate it.
You bet. So I could spend about an hour talking about your credentials, but
please don't.
I wanted you to tell us what kind of things have made a difference to you in your career to become a Director of Health, and then we can talk about your vision for the department.
Well, I've always been someone who believes in prevention, and I'm a systems thinker.
Yes.
So population health, public health is just really a natural for me. When I was deciding to go to medical school, I was working in a cardiovascular research lab, and the purpose of that research was to try to reduce the size of heart attacks. And I remember at that time, before I was even in med school, saying, why are we trying to reduce the size of a heart attack after it's happened? Why aren't we preventing them? So I've always had that mindset that we should be working on things upstream and trying to prevent problems from happening.
Right. That's neat that you mentioned that, because that was even before med school, before becoming an executive and before becoming a director of a department. So it's really unique. I mean, to see you become Director of Health the same time that we have other people that you've been working with very closely for years, as our new, I should mention, our new Director of Human Services.
Yes.
You know, and so the changes at the governor level are really quite profound. And you've just been at this for a few months. I mean, you've been director now for several months, I guess.
Right.
Maybe the confirmation was just finished. But tell us about it. What's it like now changing over from that role where you were running a gigantic hospital system to now this huge department? Tell people a little bit about the Department of Health in case they need to be reminded how big it is.
Yeah. Well, it was a natural transition for me actually to come back to the Department of Health, because I was very focused at the Hawaii Pacific Health working on community needs assessment, community benefits, and government relations. So I was very much in tune with still working quite a bit with people at the Department of Health and in the communities. So I was pretty much aware of what the issues are still out in the community. And having been there before as a deputy director, when I stepped back in, it was pretty much the same people, and I just sort of like, well, now I'm in charge instead of being a deputy, and the people there are outstanding. The issues haven't changed. A couple of things have become a little more pressing than others. But, you know, the mission of the Department of Health is to not only protect, but to improve the health and the environment for everyone in Hawaii. That is a tall charge. And as you know, having been on many committees, there's only so many resources to go around. So the toughest part really is assessing and really deciding with data what are really the most pressing needs. And my bias is always going to be towards prevention, but it's hard to get others to fund prevention, because when it works well, it's felt it's not needed, right?
Forgotten.
You don't have the problems downstream. But so I want to focus both on prevention, as well as there's some very pressing issues that we just have to deal with right now. I want to get those under control so they don't keep coming back as a problem, and we can work a little bit more on preventative and community benefits.
I love it. Well, I think you're going to be the person probably to make the case successfully once and for all that we invest in prevention, those resources, and I know you'd be tough, should come back and be reinvested in the Department of Health and Human Services.
You have to remember you said that. I have this on tape.
Hey, I'm happy to see more money spent on the Department of Health. I really love that. And I think that has been a challenge. I think you're totally right, because the prevented heart attack goes unseen,
That's
unheard
right.
about, right?
People think it wasn't going to happen.
Right,
They didn't
exactly.
realize that we actually prevented it. It's hard to prove.
Yeah.
But that's where the real joy is. This administration is very much into collaboration.
Good.
And so all of the departments are working, the cabinet, it's taken a while for the cabinet to be filled because the governor's been very serious about selecting the right people for the cabinet who will work together collaboratively.
Yeah.
And so that's my modus operandi, is to operate collaboratively. I'm always looking for the win-win. So I'm having a wonderful time working together with Rachel Wong at the Department of Human Services and Superintendent Matayoshi at the Department of Education, and Linda Rosen at Hawaii Health Systems Corp. And
there's no men there at all, it appears.
No, I was about to say Nolan Espinda at the Public Safety Department. So there's what we do at the Department of Health is so much more impactful if we're working with other departments where we can find the win-wins. And working with the Department of Human Services is where I think we're going to find real opportunities to improve the health of the population in Hawaii.
Yeah, I sense that too. We had Rachel on the show, I think maybe actually also around a week after she had been confirmed. And she sang your praises, and we knew that you guys were coming on together. The neat thing about this is I was so stunned actually when I first got into the legislature that there was such a separation between the Departments of Health and Human Services when they do so many things that are absolutely at least in synergy, if not completely overlapped. And now you have that opportunity, because if I'm not mistaken, you worked really closely with Rachel when she was over at HAH. Well,
right.
What was that like?
That's right. Well, Rachel was the one who really initiated and got all of the hospitals together in Hawaii for the community needs assessment. That is now something that all the hospitals do on every 3 years. They do an assessment of the community and then have a plan of action each year to improve community health.
Okay.
And what she did was get all the hospitals to come together and say, well, why don't we do this together instead of everybody doing it independently? So that was very powerful, because when you put everybody's resources together to gather the same data, and then we're all working off the same song sheet, but we've got the specific data to the area that that particular hospital serves to determine what's the greatest needs here, where can we make a difference?
Right.
And then where are there commonalities where maybe we all focus on something such as obesity or smoking or.
Yeah, gosh, I mean, there's just so much to talk about with you, as I think it's just hard to even contain it. So let's talk about that. So you guys did the needs assessment in partnership, your executive role, and then on several of the planning and strategic planning committees with Rachel. Mm-hmm. You know what the big issues are.
Right.
And she knows. So
that's why it was so easy to come back to the Department of Health. And the Department of Health has a role in it as well.
Right.
And it's part of one of the things I want to do is get the accreditation for the Department of Health. And one of the requirements of that is to be actively engaged in the community assessment. So that's not only the Healthcare Association, but it's the Department of Health, and it's everybody and all the agencies that affect all of those population health indicators.
Right, and you were also involved, I'm not sure if people know this, but for our previous administration, you also worked on the health transformation plans with Beth Giesting, who's often been on our show and is really terrific. Tell us a little bit about how that might color how you proceed as director. Is that going to be helpful to you?
Yes. And in fact, Rachel and I meet on a weekly basis with Beth Giesting and Joy Suarez on the Health Transformation Group. And they just got another $1 million grant from the federal government to do the next phase of planning, and we all agreed that we need to focus that on behavioral health and oral health, two neglected areas. And so this is an area where Rachel, the Department of Human Services and Department of Health working together can really make an impact on behavioral health, because it has been neglected. It's always been sort of this outsourced other thing that's not integrated into the medical chart because it's kept confidential, and yet that becomes counterproductive, because over 30%, your ER doc, over 30% of our admissions to the emergency room have a comorbidity of behavioral health of some kind. And so if we can start addressing those issues in the primary care office and in the community, screening for substance abuse, for depression, prenatal screening. That's one of the things that we want to do is get prenatal screening, just routine. Every woman gets prenatal screening. And, as you know, even that's not early enough, but at least you have a captive audience when someone is pregnant, when the data shows that up to 80% of those women will, in fact, stop smoking or stop their drugs or alcohol if they realize the impact on their child. So,
well, it's just, it's just amazing to hear you say that because, first of all, the fact that you guys can go right into the problem is wonderful because you don't have to wait and plan. I mean, you've been doing it.
We're just waiting for session to get over with so that we can move on to the.
God bless you.
To get some things.
You do it.
But we haven't waited. We're already starting some of these things.
Well, what you said was just, first of all, was a reflection directly of what I think that the first major needs assessment report that came out, if I'm not mistaken, the number one preventable admission was related to mental health. Is that right?
That's correct.
So
correct.
So you brought that right with you from that previous job, and there it is. Now it's a priority for Department of Health.
And that's the idea. That's the kind of data that we use to make smart decisions about where should the resources go, where should we focus this limited amount of resources we're going to have and have a biggest impact on health in the community.
Right. Yeah, and even this, it's just so relevant because this weekend, so absolutely, this past weekend when I was on call, I had one pair of patients that came in that had a domestic squabble and young people, and one stabbed the other. So the one who stabbed the other needed psych help afterwards, psychiatric support. The one who was stabbed needed, repair, and she did fine. I had that patient, that couplet of patients. Then I had a gentleman who was having challenges just with his diabetes and so on, and was also having some joint pains, but didn't want pain pills because he had had crystal methamphetamine addiction in the past, and he came clean with me. So those were cases. And then finally there was another woman, it was a very busy weekend, who has schizophrenia, and she needed her meds adjusted. She knew to come in, she has a family, she has a job, she's doing great, but she didn't have access that particular Saturday because her psychiatrist was not available that Saturday. And she came in. And so these are real issues that are going on.
And we're never going to put you totally out of business as an ER doc, I'm sorry to say, but,
I'm sure.
But there'll always be a need for that. But hopefully we can reduce those kinds of incidents if we have more community-based programs and early outreach so that we get people into the services that they need and community-based services so they don't have to be in the hospital.
Absolutely. Obviously the fight that resulted in a stabbing would be wonderful to prevent. And the other two cases, I'm sure those individuals, had they seen their regular psychiatrist, they would have been in, I think I did an okay job, but they would have been in better hands because the continuity of care and the patients were known by their doc or their nurse practitioner, and it just, it's so much better. So the way you describe the system is really the way.
And that takes us back again to why it's so important for Department of Health and Department of Human Services to work together, because we talk about the social determinants of health. This, so much of this, the behavioral health issues, much of it is related also to social determinants, meaning poverty, education, the built environment around one that creates stresses, and it becomes a vicious cycle to a family. If they see that if the parents are fighting, then the children grow up in that, and there's trauma on these children.
Right.
And so, we've got to be smarter about intervening with social types of services which will ultimately impact the use of healthcare services.
Yeah, and your ability to speak that language and to have that relationship with Rachel, the DHS director, is incredibly valuable. I don't think people could possibly tell from our program today how valuable that is, but it really is, because though there's always been good collaboration between some of the folks, there's never been this kind of.
This is unprecedented, I think,
This is very different. And I've watched several directors of health. I've been fond of each of them, and I've watched several human services directors, and I've liked most of them, we should say. But they never were like this, where you can explain very cleanly, if we invest in Rachel's division over here, we may not need to focus on trauma services or alcohol and drug rehabilitation. So it's a big step in the right direction. I think Governor Ige did, I almost said Senator Ige, I think Governor Ige did a really great job in picking the two of you coming into this department, I guess tandem.
Yeah, well, it was part of my decision when I saw who he was appointing to his cabinet, and the respect I have for the governor already when he was senator. It's what pushed me over to say, I need to do this.
Well, I gotta say, it blew my mind when I heard that you
Mine
were
too.
you were gonna make the jump, but I was super pleased.
I had just finished telling my husband again in the presence of someone else that I can't take this job, it would kill me.
Yeah.
And then it was at the inaugural dinner, and after talking to a whole lot of people, we got home and I told my husband, he said, you don't want to take that job. I said, well, it would depend, and he went, what?
Oh boy.
But within 10 minutes, he said, yep, you should do it.
Well, I'm glad he was supportive. We're lucky to get you.
He is.
This is a good time to take our first break, and when we come back, I think maybe we'll talk about hospitals.
Okay.
Does that sound good? I'm Josh Green, host of Healthcare in Hawaii, today joined by our Director of Health, Dr. Ginny Pressler. Thanks for joining us.
Okay, this is Think Tech Hawaii, and it's Wednesday. Every Wednesday is Energy Wednesday here in Hawaii, the state of clean energy. 4 to 5 p.m. every Wednesday. Come and listen to us. And just to show you what I mean, I'm going to ask Sharon to tell us more.
Come and see us every Wednesday, as Jay said. And we have people like Jim Albers from HECO here and co-host Ray Starling here every Wednesday. We not only go on Olelo and OC16, but also stream live. So please come visit us, hear about the latest in clean energy.
Okay, Jim, you've been here. You got any comment on all this?
As important as energy is in all of our lives today, this is a great forum and a great format to vet those issues. So I encourage everybody to listen in and participate.
Okay, Ray, what do you think for a close?
Well, I think this is the greatest show in the energy world here in Hawaii. You can come here every week, 1 hour, and catch the latest on what's happening and hear from the people who really know what's going on, like Jim Alberts. We appreciate your coming today.
Thank you.
Ray Starling, Sharon Moriwaki, Jim Alberts, and Jay Fidel here in Hawaii, the state of clean energy. 4 to 5
Aloha.
p.m. Wednesday. Aloha.
Aloha.
Aloha. Welcome back to Healthcare in Hawaii. I'm your host, Josh Green, Chair of the Senate Health Committee, and today joined by our Director of Health, who was confirmed last week. He's been acting as our director for several months now and comes with actually a bevy of credentials. Was recently a chief executive over at Hawaii Pacific Health. She's been with the department before. She's a surgeon. She really had all of the possible criteria we could hope for. She now joins an administration, the EGA administration, to solve problems for our state for the next several years. We're lucky to have you.
Thank you.
So we were just settling in on some of the priorities for the department, and then we shifted our attention, you and I, to some things that go on in the hospitals. But you were mentioning as we were taking our break that the Hawaii State Hospital, an issue that was very, very hot last year. The Senate had an investigative committee. We looked at it, big challenges. We worry about that hospital and the patients that need to go there with mental health conditions. Why don't you give us an update?
Yeah. When I first started at the Department of Health, I knew that there was issues at the Hawaii State Hospital, and I was delighted to see your report that came out that had evaluated it. So I was like, oh, it works. I can
We
see
got a list of things
you've
there
already
for you.
done the work for me. I know what we need to do. And so we have, in fact, been moving forward on all of the things that you've recommended in that report.
good of
So
you.
that was a good collaborative piece. But when we were talking about prevention and the need for hospital services, the Hawaii State Hospital is a perfect example.
Yeah.
For the listeners, the Hawaii State Hospital is the only state mental hospital,
Right.
and it's in Kaneohe. It was originally built for 175 patients. The census has been over 200 patients for years now, and most recently we were up to 216 patients, I think, last
Wow.
week, and now I think yesterday, I don't know where we are today, but yesterday it was like 205 or something, and we're taking safe care of those patients, and they're getting the services that they need, but we really maxed out. Now, the reason we've had that problem is because of all of the community-based, the clubhouses and the services in the community to stabilize these chronic patients.
Yes.
A lot of those services were cut. It's a perfect example of if you don't invest in prevention,
Yes.
you pay for it bigger time
Right.
than you did for prevention. You pay big time downstream.
Yeah.
And so we're still suffering from that now, and we're trying to play catch up to rebuild some of those community-based services so that we can cut off the stream coming into the hospital on a regular basis.
Right.
And then in addition to that, we know that we're going to have a growing population of chronically mentally ill, some of whom cannot be in the community.
Right.
And many of whom we have some that have been there many, many years who will be there the rest of their lives. They can't go back to the community setting.
Right.
And so we need long-term care facilities for them. So we've had plans I remember previous directors, I said, when are you going to get that new long-term care facility built for the mentally ill.
Right.
And, oh yeah, it's coming, it's coming. So we're going to do that now.
Oh,
it's a
exciting.
private organization called Avalon, so they're going to build it at their expense, and then we'll be able to move those patients over there.
Where would it be built? Where?
It's right on the campus there.
Ah,
It's what the Bishop Building is called right now. It's just between the Windward Community College as you come up the road on the right just before you turn into the hospital.
I know what you're talking about.
And then we want to build a new state-of-the-art, modern hospital that would house 250 patients instead of being built for 175, with plans for a second 250-bed hospital. So over the next decade or so, if we get the capital improvement funds that we need,
Sure.
then we could build a 500-bed hospital
Wow.
that's state-of-the-art and can take better care of these individuals and provide safer venues for family and others to visit.
That's such
And then
incredibly
on the
good news.
campus,
Yeah.
we'll have the long-term care and also more outpatient type of things.
Right.
And then working with the community to develop comprehensive, mental health services. And then one of the things that we're doing with the health transformation, the major focus, as I said, is on behavioral health.
Right.
And what we want to do there is to try to get to the lower end and make sure that we have behavioral health embedded into primary care.
Right.
So that all primary care physicians know where to go to help get services for their patients, and they're comfortable screening
Yes.
for depression and for substance abuse because they know that there's something they can do about it.
Yeah.
And if they're not comfortable dealing with it themselves, that they know where to send the patients.
Well, it's so interesting. Talking to you is really it's a mind-blowing experience because you're so deeply embedded in all these problems in the right way. One thing that you just said before we come back to the hospital, which makes me happy beyond happy, I can't tell you, to give them those services and have that plan, was, for instance, I almost hesitate to bring it up. This last week, I got myself in hot water for not passing a bill at the Capitol that allowed psychiatrists to prescribe or
Yes.
program. And for lack of a better, more comprehensive description, just from my perspective, wasn't quite ready yet.
Mm-hmm.
But I have so much utter respect for psychologists, and one of the reasons that I had a hesitation or pause about doing that, which would take many extra years for the psychologist to prescribe, is that they're so valuable as members of the primary
Right.
care community. And what you just described is actually what I had been thinking, which is
Right.
we need to expand the primary care capacity, not the end game capacity of psychiatric care. We need to help a lot more people right along next to their family docs and their nurse practitioners. I would prefer personally to see psychologists be considered primary care providers in a way, because
Well, what I'd like to see us do,
Yes.
which we'll be really launching into after session, is to really look at the team of mental health professionals. So you have the psychiatrists, you have psychologists, you have social workers, you have counselors, you have career, folks, you have outreach workers, and this team needs to be working together so
Right.
that we can maximize the use of the limited resources we have.
Right.
We will never have enough psychiatrists to go around, and nor is the psychiatrist the right one to intervene in
course
many
not.
cases.
Yeah.
Sometimes a psychologist is better, sometimes it's a social worker, because
Sure.
we start addressing those social, indicators of health, social
Yes.
determinants. It's all related, and so that's one of the things that will hopefully be coming out of this health transformation
Yeah.
plan, is to develop that capacity in the community.
and you're the perfect person once again, because you also have those relationships with, with the Mike Golds of the world and the heads of Aloha Care and the heads of Kaiser and all these plans. So you can help them to understand and I'll be there at your back,
Yeah.
to help them to understand, yes, please reimburse for these services for psychologists and social workers. And they're leaning that way anyway, just like the program that you put in place with the Physician Health Organization out of HPH. That is central to really what the patient-centered medical home needs to be. And I've been kind of disappointed. One of the few disappointments I've had about patient-centered medical home has been that it hasn't really been able to incorporate behavioral health and mental health issues into it well. We haven't done a good job yet with that, just from my perspective. And it's been so necessary. But look, I don't want to dwell too much on that because I'm excited to hear about the plans for the Hawaii State Hospital.
Yeah.
So that's wonderful news. Tell me a little bit more. So,
Well, we need some help from the legislature
what's
still.
the
We-
plan? Next year to ask, or what do you think?
Well, we got a couple of asks.
Yes.
One is additional funds to pay for the extra patients that are in there. So we have we get resourced, it's a 170-bed hospital. We
Right.
get resourced for 175 patients.
Oh.
When we have over 210 every day,
Yeah.
it costs us that much more services for those patients,
Sure.
the physicians, the support staff, even the electricity and the food and the
Yeah.
space. It costs us, and then we end up with overtime, trying to take care of the fluctuations.
And they get
and
burned
all.
out, and these
Yeah.
problems occur. You're totally right.
So we need more money in the short run until
Yes.
we build more capacity. We need more money for the extra patients that we have every day. And we need money to be able to tear down the old Goddard building
Yeah.
so that we can start construction on the new 250-bed hospital. We can't do a thing until we get rid of the old Goddard building, which has now become a public health hazard.
Sure.
It needs to come down, and so we're asking for a couple $1 million for the demolition of that building.
That sounds great. And again, remind me, so the long-term care, the Avalon group that comes, do they have to knock anything down to build that, or is there already land for that?
The Bishop building, I think, would be replaced
Okay.
with a new building. And
Great.
they would do that. That wouldn't be state dollars.
Right.
Yeah.
That's good news.
And
we
we
had-
also are asking for some money to help for additional security, as you pointed out
Yeah.
in your Senate report.
Yeah, that's right. The community is, and rightfully so, they're always sensitive, because these are patients that have real challenges. I mean, for people who haven't been following this dialogue, I know you
Yeah,
know
well,
this.
we haven't had our community meetings yet, so I may.
I'll be there
maybe
with you. I would
saying
love
more
to be
than I
supportive.
should, because
Yeah.
we will be having the community meetings, I think, May or June, to make sure that the community's aware of what our plans are and getting their input.
Well, please do invite me or whomever who you think would be helpful to be supportive, because I think that it's one thing that breaks my heart when I have my physician jacket on is just so many people need a place to go. They need some help with alcohol or drug rehab. They need a place to get treatment just for regular schizophrenia, and a lot of times we don't have those beds because everyone pretty much at the Hawaii State Hospital has had serious drug problems, crisis, and then is there for so long, and we don't have the capacity. But you, if this goes forward, which you'll have my support, will be able to probably solve that problem for many years to come, because that's a pretty big
Yeah,
expansion, as
right.
I hear it
This is
from
a
you.
long-term plan. We're talking 10, 15 years to
Sure.
finish this.
Well, that is just great. So, that's kind of breaking news, actually, which I'm excited about. And when the community gives input, I think that they will be receptive in
Yeah.
general, because I think everyone has a family member or a relative nearby in a nearby town, or someone from their extended, Ohana that has had need.
Right.
And
this will reduce the impact on public safety as well, OCCC.
Right.
Again, these individuals who get into trouble, who are on drugs or depressed or acting out,
Right.
and have social issues, all of this ties together.
Right, incredibly expensive. Plus, the human cost is just their lives,
Tragic.
are no good. And then
Yeah, and their kids.
Their kids are
They're
lost.
Traumatized.
Oh, God.
They are traumatized, and these
Yeah.
children grew up in a scary world. So we have to stop the cycle.
We do. Well, this is a really good step, actually. That's a great step, in fact. Anything else you'd like to add about the Hawaii State Hospital or?
Those are the main issues, and it all ties back to the health transformation piece and the Department of Health, Public Safety, Department of Human Services, Department of Education efforts working together, because we want to get more support in the schools too for school-based health and addressing early, interventions for children that have behavioral health issues.
Yeah, I think you're right on the mark. One time, maybe 5 or 6 years ago, I was talking to, actually, I think it was late and dear Loretta Fuddy, director at the time, and she had told me if I ever looked at the departments to look objectively, because she said that the work that has to be done for that division, for the mental health division in Department of Health, can take over your life.
Oh, yes.
And
Any one of my programs could take over my life. I have to prioritize every day.
This one seems to, but you're out ahead of it, and
Yeah.
it kind of pleases me that report was of some value.
It was.
They did good work on it, and though some of those hearings were, they were tense, there's no question. I felt good by the end that people were candid about the challenges, A lot of the workforce came out. A lot of the patients, when I went and visited, told me what they felt, and it kind of is reflected by what you're planning. So
I want people to know that we have made progress just in the last few months. I mean, we are doing things to improve the situation.
Yeah, well, we got the right director of health, so this is really great. I think what I should do is, why don't we take our last break and then come back for just, basically the last 15 minutes to talk about your personal vision for healthcare in Hawaii.
Okay.
Okay. Today, I'm joined by Director Ginny Pressler. I'm Josh Green, your host of Healthcare in Hawaii. Thanks for being with us.
Hi, I'm Ethan Allen. I'm the host of Likeable Science on Think Tech Hawaii. We talk about why people should like science, why science is actually fun, how science is a dynamic and vital part of everyone's life, why everyone, every man, woman, and child on the planet should really know science, should love science, should be familiar with science. So it's a great show. People come on here and have interesting conversations with us. They tell us why they do what they do, why they love it, why we should love it too. I hope you'll join us every Friday, 1 to 2 p.m. And of course, you can see it anytime on YouTube. Aloha.
Aloha, welcome back to Healthcare in Hawaii. This is a very terrific day for me because I get to interview the new Director of Health, Dr. Ginny Pressler. In our first two segments, she was able to express her passion for prevention, and that really means a lot to the state of Hawaii because we know as physicians, as health policymakers, that an ounce of prevention, and it's cliche, is worth a pound of cure. We have many challenges in our healthcare system. Resources are a big one, as the director pointed out, but by focusing on prevention, she knows that she'll have a reward downstream. Then in our second segment, she spoke very passionately about some plans, though in their early stages, that will help us with our mental health challenges here in the state of Hawaii. The Hawaii State Hospital has been a point of very serious concern, but our Director of Health, who has a lot of experience in the hospital world, was able to leap on that problem and is already making some strides. There are too many patients at the hospital, and she knows that the plan to expand, though will have to be taken to the community, could reap great benefits for us going forward. She's talked about expanding services and support, some of the clubhouse services, more primary care services. This is an individual who really knows our healthcare system, so we're lucky to have Ginny here today.
Thank you.
So, okay, we've got a few minutes left. We haven't touched on some of the other, you've got a department of like 5,000 people and I don't know how many divisions.
I think it's down to 3,000 now. There've been some cuts.
Wow.
3,200 or something like that.
Still huge.
Yes,
and
it's still large.
I don't even know how many divisions do you have.
I'm not sure. I don't know how many, I've been out trying to meet with programs, and it's going to take me a while to get to all of them because they're throughout the whole state.
Well, everything ranging from tuberculosis to
That's
HIV
right.
help to the hospitals to the mental health care hospital to, heck, environmental health
Environmental
issues.
health.
That's another big division.
Yep.
What's that been like? You've been in the hospital and clinical world.
Yes.
What's it like in environmental health?
Yeah, environmental health is the one area where I was not as knowledgeable, and so I've been on a steep learning curve, and instead of just saying, well, I'm not going to get involved in that, I see many of those issues are very pressing that I need to be involved in, and so I am trying to learn. I love to learn new things, and I've been on a steep learning curve about environmental issues. As Director of Health, I sit on the Water Commission.
Right.
So I'm being exposed to all kinds of very interesting and pressing issues that we need to address. So
Yeah.
we've got, the good thing is I've got really solid people. Our new Deputy Director of Environmental Health, Keith Kawaoka, is a PhD in engineering and environmental issues, and he's been in environmental work for 30-something years. So he was running the division before he became the Deputy Director. So I've got very competent people. I meet with them on a regular basis. I just troubleshoot with them, help them decide which direction to go, and then I say, go for it. You guys know what you're doing better than I do. I don't second guess what they do.
Yeah.
And I'm trying to learn more so I can be more of a useful resource to help them.
Well, just having a strong leader at the helm is terrific. I've liked all of our directors, but you do bring a different kind of skill set that's quite something. I was thinking about, as you were saying that, the Red Hill issue. For those who haven't had a lot of conversation, we won't spend too much time on that today, but Red Hill, which has 20 tanks, I believe, underneath the ground that hold the fuel for the entire Pacific fleet, as everyone who has read the paper knows, there was some leak. And a leak, if it's is significant enough, can get into the water supply. If it gets in the water supply, it can make people sick. And
Right.
so that also falls under
And
your...
that's why we get involved, because we
Yeah.
have to protect the water supply, because, you know, the area at risk is up to 25% of our municipal water. So our job is to protect the water for the people in Hawaii.
Yeah.
So those are ongoing discussions with the Navy, which probably are not for prime time right now.
Yeah.
Because we're still working on it.
Of course, yeah.
But we will come up with a solution that protects the water supply for the people of Hawaii.
Yeah, it just underscores how gigantic the responsibility of the Director of Health is. People probably would tend to think of it as in terms of traditional health issues, like the hospitals, or making sure there's doctors and nurses for us, or making sure, you know, we don't have food contaminations and so on, or outbreaks of disease. But the fact that it also is water quality, that it's also air quality, it is just a gigantic and important job. So it's neat to have.
We even have a little detector on the roof of the Department of Health for radiation from when the Japan
Fukushima reactor went up.
happened. Yeah.
I know. The Department of Health actually, I'm very biased, but it's the neatest job. Because it is. There's all those directorships have incredible responsibility, and I have so much respect for those who are willing to do those jobs. But Department of Health, it crosses every possible boundary that I could imagine, and
that's why I love my job. As difficult as it is, I really do enjoy it.
Oh yeah, you should have a blast. We've had issues like obesity. You've been a leader on the obesity. How would you say you'll be able to translate a lot of? You were the co-chair of the obesity task force, right?
I would, yeah. Most recently, the chair of the state obesity task force.
So I can assume we'll have recommendations going forward from that.
Yes.
What other things would you propose you'll prioritize?
We can't take our eyes off tobacco control.
Yeah.
You know, it's.
You started that that fund
the
back in.
master settlement agreement back in, was it 99 or 2000?
Yeah.
1999, and we put 60% of the money went into prevention services. And those monies over time have all been supplanted. You know, all the general funds have been supplanted with the special funds from the tobacco fund. So that's an issue that's going on in the legislature now, with moving those programs back to general funds, because we got a diminishing amount, thankfully, because people are smoking less.
Yeah.
But we can't take our eye off the ball, because I do have concerns about electronic cigarettes, and the data I've seen is concerning, that suggests that our kids, who are rapidly increasing the use of electronic cigarettes, end up being smokers as well.
Yes.
And so there's very concerning data that's still preliminary, but it's not, doesn't look good.
Yeah, the university brought that. I think you're alluding to some of the university reports, or the Cancer Research Center report maybe, that showed it was like a 400% increase in adolescent use of e-cigs. And I know that it's controversial. I know that people who are in that industry are concerned that we're going to overregulate. But right now, from my perspective, someone who becomes addicted to nicotine,
they're at risk for cigarette smoking.
Yeah.
And before we finish, I shouldn't neglect, I mean, there's so many issues, as you said, Department of Health. I don't want to neglect to mention our kapuna.
Yes.
And I'm very concerned about our elder care, and I know that I'm working with the AARP and the Executive Office on Aging. I've actually made a national pledge with the Association of State and Territorial Health Officers, which is a national agenda to look at support for caregivers.
Yes.
So after the session, I'll plan to launch into some dialogue with all of our organizations that work on services for the elderly, so that we can come up with a more comprehensive approach to make sure that we're providing the care needed not only to those individuals so they can age in place, but also their caregivers who get burned out.
I agree. Look, they love to fight on that bill, and I respect them for it. But more power to you, because I tell you, that's going to require, from my perspective, someone who does understand the hospital system.
It's not just about hospital.
No.
It's the services in the community, which is where I want to focus.
Yes, and I think that one of the interesting things, the physician health organizations and the clinically integrated physician network that are forming these bodies that are doing kind of more than just doctors and nurses used to do in their clinical practices, I think is another potential resource for some of this work.
That's right.
Yeah, I would hope that, I think that the AARP needs to open their minds to that and realize that, because a simple quick fix at the hospital exit moment is not comprehensive enough for
No,
individuals.
I didn't think that was
Yeah.
the solution either.
Yeah.
But we do need to do something to address the needs so that we can keep these individuals in the home.
Yeah.
There's a lot more we can do in home-based care, I think, if we get the services, social services.
Right.
It doesn't necessarily need to be medical care. In many cases, it's really social services that can help keep these individuals at home
Right.
and not being hospitalized.
For sure. No, absolutely. And once again, that fusion and partnership that you're going to have with the Department of Human Services, where a lot of these services and programs fall, I think will be, invaluable. I can't
Right.
even imagine. Yeah, that's going to be very interesting. And then we've got young teenage moms and teen
Yes.
pregnancy rates.
Yes. Teen pregnancy rate has gone down. It's impressive to see that. That's very encouraging. But we still have way too many
Yeah.
teen pregnancies, and we would like every child to be planned
Yeah.
and be able to be in a secure, supportive environment. Not that the parents don't love them,
Yeah.
but they don't always have the resources to provide the kind of environment that they need to nurture a child and have them grow to their full potential. So we need to be more cognizant, again, of those social services and make sure that every pregnancy is a planned one.
Oh, tell me about it. I mean, Jamie and I had our first child when I was 37 and then 40, okay? And I was a physician, senator, and I still felt totally
Yeah. Overwhelmed,
ill-equipped
right?
and overwhelmed to raise that
Yeah.
child.
Kids
Maya
do
and
that
Sam.
to you.
Yeah, and so I can only imagine. I took care of a 15-year-old that was pregnant
Yeah.
this weekend, wonderful young woman, great boyfriend, but I saw what's in front of them, and it's
Yeah.
going to be a big challenge.
And if they don't know how to pay the rent and they don't, there's stresses and then,
They're in high school, for now even, so I can only imagine.
Yeah.
Now, we only have a few more minutes left,
Okay.
and we've covered just an
Yeah.
incredible breadth of issues. What else would you like to share? You've talked about some of these synergies with other departments. Is there any other do you have a pet project that you think you might engage in the first term? What are you thinking?
Well, I do. I think I mentioned earlier the intent to get the State Department of Health accredited.
Yes.
That will be a major project.
What does
It'll
that
probably
mean?
take
Tell me a
couple
little
of
bit
years.
about that.
It's similar to accreditation of hospitals and nursing homes and others. So what happens is it creates a national quality standards that just raises the bar. And so we have to meet, certain criteria on excellence, on best practices in public health. We already have, we're one of the best in the nation, I think, already. We've got some of the best health statistics
Sure.
for public health, population health, anywhere in the country, so we have a lot to be proud of.
Right.
To me, that's not enough. There's never enough done
Yeah.
in terms of improving the health of the population. So I want us to become accredited and make sure that we are, in fact, bringing the very best practices,
Mhm.
that, looking at who does the very best on something,
Yes.
and even going beyond that, we don't have to be confined to what someone's doing in another state. How can we do things differently beyond that even?
So I can assume that other states have gone through this process?
Yes, it's
Okay.
becoming a growing trend. I don't know how long accreditation has been around, but it was just a few hospitals, and now more and more are moving in that direction. I think that that Hawaii deserves to have their State Department of Health accredited as well.
You're probably the right person for it, having been through accreditation processes.
Yeah.
Tell me, does that bring more resources? Does it bring, what does it get you, I
Yeah.
guess is?
Well, I think it gives you credentials, yes, when
Okay.
you're looking for grants and things like that. I think in the future, it probably would be more difficult to bring down federal dollars if you're not accredited.
Got
That's
it.
not the case right now, but I imagine that will be the case in the future.
Sure. And I do know that there are some models, like for instance, I recall the Department of Transportation said that if we met certain, I don't know if they used the word accreditation, but if they met certain milestones and had a checklist that was thorough, they were able to draw down a lot of extra federal funds. So it stands to reason that the feds, while money's tight everywhere, would decide, the best departments of health across the country would,
Yeah.
deserve the
They
extra
at least
resources.
meet these standards.
Yeah, that's so exciting. Okay, well, we have 2 minutes left today. We've gone through accreditation. We've talked about the mental health needs of our state. We've talked about prevention and the synergy you have with the departments. You got the last 90 seconds to wrap it up. What kind of dreams do you have?
I'm tired just talking about it.
I know. Well, I know you have to get back to the governor today, and so
Yeah.
I'm just really so grateful that you came on to the program. We'll have opportunities in a few months, I hope, to maybe bring you and Rachel together. We
Yes,
can talk about
about
programs.
Specific programs that we're working on, yeah.
Yeah, well, you'll get your breath when the chaos of the legislature ends, and then we can kind of resume.
Right.
Okay, well, Director, thank you for coming.
Thank you, Senator
been great.
and Dr. Josh.
Yeah, it's good to see you. This has been a great show. I'm joined by the Director of Health, Dr. Ginny Pressler, who's a surgeon, and a hospital leader, and now the head of the Department of Health, which is a gigantic department with responsibilities that range from environmental health and our water and our air to the hospitals and the patients that need it. So we've been lucky to have her here for 45 minutes to an hour. We'll be lucky to have her for the next several years, and she's going to be leading us in our department with a great vision to take better care of the people of Hawaii. Thanks for joining us. I'm Josh Green, Senator from the Big Island.